The next question is, doctor, what is the most common reason for IVF failure? The most common reason for IVF failure, it would be, I would not say the most common, it could be either the egg quality, it could be the sperm, the DNA fragmentation in the sperm, it could be a poor embryo. If the embryo quality is not very good, IVF can fail. It could be the endometrium. If the endometrium is not receptive, or the endometrium, first of all, we have to look into the thickness of the endometrium, the blood flow of the endometrium. And so, if the endometrium thickness is not good, if the blood flow is not good, or if the receptivity of the endometrium is not good. See, if somebody has an IVF failure, we have to identify why. Before going for the next, telling the patient go for a next cycle, before we tell them to go for a next cycle, we should identify why they had a failure. Either it is because of the poor egg quality, or it is because of poor embryo. See, obviously we are forming an embryo. So the final outcome is whether they had a good embryo or a poor embryo, or whether the endometrium is good or not. If somebody has a good embryo but still has an IVF failure, then what is the problem here? Either it could be endometrium problem or the genetical potential of the embryo. So if you're not genetically screening the embryo, somebody has going for a first IVF cycle and they had a failed IVF, but their embryo is very good. So now where is the problem here? Whether the embryo what we're transferring here, we just look into the microscope and see whether the embryo is morphologically normal or not. But we're not looking into the genetical potential of the embryo, whether that embryo is euploid or aneuploid. So somebody who's having a good embryo but failed IVF, we have to see whether that embryo is genetically normal or not. Or somebody is having a genetical normal embryo but failed implantation, then we should see whether if the endometrial receptivity is normal or not. So this is what we have to check. What is it? Is it the embryo or is it the uterus? And then we get the answers, and that is how we go to the next step.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.